going to be the defense you're going to see this year.
Yeah, I was saying the front four was the starting front four. Oh, big collision. Pass intended for Percy Harvin, and Earl Thomas ran right into it.
In this video, we are going to explore the case of Earl Thomas, a Seattle Seahawks safety who sustained a shoulder injury in the 2015 NFC Championship game. In doing so, we will review key anatomical structures in the shoulder, the different types of labral tears that exist, dive into treatment options and recovery timelines, and review the case of Earl Thomas as it relates to these objectives. The shoulder joint is the least stable joint of the human body. It consists of three bones: the proximal head of the humerus, the scapula, and the clavicle. The head of the humerus fits into the glenoid cavity of the scapula, creating a ball and socket joint. The glenohumeral and transverse humeral ligaments help to stabilize the shoulder in the cavity. The labrum is a piece of fibrocartilage, or rubbery tissue, attached to the rim of the shoulder socket that helps in keeping the ball of the joint in place. It helps deepen the socket of the shoulder, allowing for further stabilization, as well as acts as an attachment for both the long and short heads of the biceps brachii.
What's up, guys? Earl Thomas here. Just want to talk about my shoulder injury that I suffered in the NFC Championship game in 2015. I went to tackle Randall Cobb. It was kind of an inside-out tackle, and I tripped him up and immediately felt something in my shoulder pop and knew something was wrong. Went to the sideline, got seen by the medical staff and my coaches, and they told me it was separated immediately.
The two most common types of labral injuries are slap tears and Bankart tears. Slap tears occur at the front of the upper arm where the biceps tendon connects to the shoulder. Athletes most prone to this injury include baseball pitchers and volleyball players who engage in high-energy, quick snap motions over the top of the shoulder. Bankart tears, on the other hand, typically occur with shoulder dislocations where the head of the humerus either shifts towards the front of the body, leading to anterior instability, or to the back of the body, called posterior instability. Posterior labral tears are the least common of the three, and is commonly seen in athletes with internal impingement or thrower's or swimmer's shoulder. Due to the position of his body at the time of the injury, as well as the co-occurrence of a separated shoulder, we assume that Thomas suffered from a Bankart tear. Shoulder injuries are common in contact sports, with up to 50% of recruits and players reporting a history of shoulder injuries, including labral tears. Labral tears in contact sport occur when the labrum becomes detached from the front of the glenoid socket. In this area, the labrum serves as the attachment point for the main ligaments that stabilize the shoulder, the inferior glenohumeral ligament. If the shoulder is dislocated, the labrum is often detached, causing the ligaments and stabilizing structures to also detach. The injury is commonly seen when a direct force is applied to the shoulder joint during either a tackle or fall, and commonly results in shoulder dislocations, as in the case of Earl Thomas. Labral tears are most commonly seen accompanied by anterior shoulder dislocations, but can result from a posterior dislocation as well. Other examples of mechanisms include following on an outstretched arm, a pull on the upper limb from an external force, or a violent overhead reach. There are two main directions for treatment options for a labral tear affecting the shoulder. The first option is a non-surgical, conservative treatment plan. The second option is for the patient to receive surgery. The first step to a conservative treatment plan is for the athlete to rest from whatever activities are causing or triggering the pain. The athlete can then engage in rehabilitation methods, such as physical therapy and massage therapy. Passive and active range of motion may be used. It should be noted that exercises to improve strength and endurance of the shoulder joint should not be included in rehabilitation until these activities can be performed pain-free. In some cases, cortisone or non-steroidal anti-inflammatory medication may prove beneficial. In a study of 15 athletes, 10 were able to return to play at the same level, or better level, than pre-injury, following non-operative treatment of a labral tear. In contrast, some athletes may elect to have a surgical intervention for a labral tear. The most common type of surgical intervention is arthroscopic surgery. While surgery is found to be most effective if performed in the acute phase of an injury, the patient must wait for most swelling to subside before receiving surgery. Alternatively, if an athlete is able to manage playing with a torn labrum, they may opt to wait to receive surgery until their postseason. The typical post-operative recovery time is a period of 6 to 8 months. The first month post-operatively is typically spent in a shoulder immobilizer. The following 4 weeks is where passive range of motion can occur, and finally 2 months post-surgery, active range of motion exercises can be implemented. A study of 53 athletes 1 year post-surgery showed that 87% had excellent results, as measured by return to play and play performance. Additionally, several studies have found statistically significant results to support that athletes may return to high levels of sport, with no decrease in range of motion. Many athletes were found to remain symptom-free 2 years post-operation. Furthermore, successful surgery was not limited to just athletes. Non-athlete and recreational patients were actually found to have greater increases in range of motion and shoulder strength when assessed post-operatively. However, this may be due to having less shoulder mobility and strength than athletes prior to the injury.
Now looking forward to the off-season, I need to see what my options are in terms of treatment. Labral tear surgeries take about 6 to 8 months to recover, so we need to take action sooner than later so I can get back on the playing field in time for the start of next season.
So, what should Earl Thomas do? Taking into account the type of injury he has, recovery timelines, and the importance of his health for his career, should he 1. Focus on non-operative therapy and training, 2. Go under the knife and receive arthroscopic surgery, or 3. Retire altogether because his risk of re-injury is so great? Earl Thomas opted to receive arthroscopic surgery on his shoulder 23 days after Super Bowl 49. He followed a typical recovery pattern of shoulder immobilization, followed by rehabilitation through the off-season. Thomas returned to the field as a full participant for the 2015-2016 season opener on September 13th. He played wearing a harness for his first few games back. Presently, over a year after his return to play, he remains injury-free and a key component of Seattle's defense.